Mr. President, I come to the floor today, as I have done each week for over a month now, to give a doctor's second opinion about the health care bill that has now been signed into law. And I do this as somebody who has practiced medicine, taking care of families in Wyoming since 1983. During that time, I was medical director of something called the Wyoming Health Fairs, offering low-cost blood screening for people all around the Cowboy State, giving them an opportunity to take more personal responsibility for their own health, to learn about their health, to help get their blood pressure under control, to help get their cholesterol down and their blood sugar under control, to help diagnose cancers early. All of this aimed at early prevention, meaning better care, better survivability, which is what I think we need to do in this country, work on patient-centered health care. So I bring to you today on the floor of the Senate my second opinion, because I think that the bill that is passed into law has failed. It has failed and has gotten the diagnosis and the treatment wrong. What we need to do, and the goal of health care reform, should be to lower costs, to increase quality, and increased access. But I continue to believe that the new health care law is bad for patients. It's bad for payers, the American taxpayers who are going to be footing the bill, and it's bad for providers, the nurses and the doctors of this country who take care of those patients. And fundamentally, I believe that, unlike what the President said, I believe this whole bill and law is now going to increase the cost of care, and the American people believe that overwhelmingly, that this is going to increase the cost of their own care and is going to also decrease the quality and the availability of the care, to the point that a national poll released just this Monday, 62% of Americans would like to repeal and replace the bill that has now been signed into law. Well, as the Speaker of the House, Nancy Pelosi, said, first you have to pass the bill to find out what's in it. And as more and more Americans are finding out what's in the bill, they are finding that there are more and more broken promises. You know, the President gave a speech, and he said, if you like your health care plan, you will be able to keep your health care plan, period. He then went on to say, no one will take it away, period. He said, no matter what, period. But the chief actuary of Medicare and Medicaid says that 14 million Americans will lose their employer-sponsored health coverage under this law. So the President is saying one thing, but the chief actuary for Medicare and Medicaid is saying something very different. And that's why the American people do not feel that this bill, now the law, was passed for them. It's for somebody else. Most Americans have health insurance that they like, are happy with, except for the cost. Unfortunately, what this body has passed and what the President has signed is going to increase the cost and decrease the availability. And for people who like what they have, they're not going to be able to keep it. Now, you say, where do we come up with that? Well, there was a article written, a lengthy article called Documents Reveal AT&T, Verizon, others thought about dropping employer-sponsored benefits. Why would that be? Well, because of the very different regime, it says. This is a radically different regime of subsidies, penalties, and taxes. And that's so much what is involved in this health care law: penalties, subsidies, and taxes. Many large companies, this goes on to say, are examining a course that was heretofore unthinkable, dumping the health care coverage that they provide to their workers in exchange for just paying the penalty fees to the government. It goes on, it talks about in the days after President Obama signed the bill on March 24th, a number of companies announced big write-downs due to the fiscal changes it ushered in. The legislation eliminated a company's right to deduct a federal retiree drug benefit subsidy from their companies. As a result, AT&T, Verizon, and others took well-publicized charges of around $1 billion. Well, this annoyed Henry Waxman, a congressman from California, who accused the companies of using the big numbers to exaggerate, that's what he said, exaggerate health care reform's burden on employers. So he summoned top executives to hearings, and he requested documents. And the bottom line, Mr. President, is taking a look at 1,100 pages of documents from 4 major employers, AT&T, Verizon, Caterpillar, and John Deere. No sooner did the Democrats on the Energy Committee read the documents that they abruptly canceled the hearings. Why? Because they found out that what the companies had said was true, and it was proper in accordance with the rules and the laws that they have to operate within. So all four of these companies are taking a look at the costs and the benefits of dropping health care coverage to people who like the coverage that they have. You take a look at what are the alternatives if you don't want to provide the health care? Well, you pay a fine, you pay a fee. So AT&T, major company, employs up to 300,000 people with health care coverage that they like, and they're in a situation where the company is saying, you know, if we drop their coverage and pay the fine, we as a company can save $1.8 billion. Is that what this Congress intended? Is that what this Congress imagined? Is that what the people of this country deserve? No, what this shows is a bill that was crammed through and down the throats of the American people by an administration desperate to have something passed into law, something that many people never even read before they voted in favor of it. And the people who read the bill carefully could see what was coming down the line, came to the floor, pointed out these things to the American people. The American people heard, but the members of Congress did not. And now there's a new study out that was reported today in the Associated Press, and it talks about what other businesses are doing. And it was a poll of 650 leading corporations talking about what do you think this is going to mean for your business? What is this going to mean for the employees? What is this going to mean in terms of health care for those folks and the cost of doing business? Well, Mr. President, right here it is. What do the employers want? Well, they have three goals, and they're the goals that all Americans would have. So you want to get down the cost of care. Whether you're an employer, whether you're an employee, no matter who you are, you want to get down the cost of care. Contain costs, absolutely at a minimum. So, do you want to contain costs? Good. You want to encourage healthier lifestyles? Good. This bill hardly does that at all. Very few, if any, individual incentives. And you want to improve the quality of life. But a mere 14% of all the responding over 650 companies think that health care reform will help contain health care costs. An overwhelming majority, actually 90% of the employers believe that health care reform will increase their organization's health care costs. And why should they be any different than what the government actuary is saying? Government actuary who took a look at the bill also said the cost curve is going to go up. The cost is going to go up. The amount that the Congress has promised the American people this would cover in terms of the costs, Congress said, oh, we're going to save money. No, that's not what the people that actually added up the figure said. They said this is going to cost money. And when the President visited yesterday with the Republican members of the Senate, I specifically asked him about this, and he still takes the tack that ultimately the cost curve will go down. The American people, certainly someone who has practiced medicine now since 1983, and the actuary who takes a look at these things, who actually does the addition and puts a line and puts the total numbers at the bottom, all say, sorry, Mr. President, that's not true. The cost is going to go up. Insurance costs are going to go up. Quality of care, availability of care will go down. So, Mr. President, I come to the floor as a physician offering my second opinion just to tell you and to tell the American people what I've been hearing from talking to people all around the country. A majority of Americans are pleased with the health care coverage that they get from their employers. But now, because of the President's new law, companies are considering canceling employees' coverage because it would be cheaper for them to pay the government's penalty than to provide health care coverage for their employees. This isn't the change that Americans want. This is not the change that Americans can believe in, and this is the change that makes Americans lose sleep at night. In this economy, with 9.9% unemployment, the last thing Americans need is a new law that makes it easier for companies to pay a penalty instead of providing health coverage for their employees. Now, this is not the company's fault. It is the administration's fault. It is misguided incentives, and that is why the American people are sick of Washington. What we have seen now, the incentives, if you're a big company, is to drop insurance and pay the fine. If you're a small company and you want the tax relief and a tax credit that's been offered, the incentive is to actually fire workers and pay those workers who are still working with you, pay them less. That's the way to get a better tax credit. And if you're an individual with a pre-existing condition and you have been living by the rules, paying those higher insurance rates through some of the state-authorized funds that have been set up and the programs that have been set up to help people with pre-existing conditions, to help people who need extra help so that they get their health care covered and that they can pay, even paying more. If you're one of those individuals, the incentive, Mr. President, is to drop that coverage, stop paying, and basically go uninsured for 6 months. And only if you take that risk of being without insurance for 6 months, only then do you qualify for what's included in this new health care law. Mr. President, we need a health care law that actually lowers the cost of health care and allows Americans to keep the coverage that they have. And that's why I come to the floor every week to tell the American people that it is time to repeal this legislation and replace it with legislation that delivers more personal responsibility and more opportunities for individual patients. That is patient-centered care that allows Americans to buy insurance across state lines, that gives people their own health insurance and the same opportunities and the same tax relief for people who get insurance through their jobs, that provides individual incentives for people that stay healthy, that exercise more, eat a little less, that get their blood sugar under control and their blood pressure and deal with health care needs as they come along, that deals with lawsuit abuse and the incredible expense of all the defensive medicine practiced in this country, and that allows small businesses to join together to provide less expensive insurance to their employees. Those are the things that we need. These are the things that we need to allow us as a nation to deliver high-quality care, available care at a more affordable cost. But this health care bill that has been crammed through the Senate with a lot of gimmicks and things like the Cornhusker kickback and the Louisiana Purchase and the Gatorade, those are the things, Mr. President, that make the American people look at this city and say, we have had enough. That is why today I come to the Senate floor and offer again my second opinion that it is time to repeal and to replace this health care law with something that will actually work in the best interests of the American people. Thank you, Mr. President. I yield the floor and suggest the absence of a quorum.